There's been an increasing number of studies over the years, especially over the past 10 years, looking at the role of exercise in decreasing the risk of cancer. And these studies, over 100 studies, have shown about a 50% reduction in the risk of getting cancer, specifically breast and colon cancer. A growing number of studies show a reduced risk for ovarian cancer, endometrial cancer as well. And now more recently, in the last couple of years, there's been studies showing that exercise can also improve your survival after a cancer diagnosis. There's been studies showing that about a year after your diagnosis, if you exercise about 30 minutes a day, or say 2 to 3 hours per week, doing a moderate intensity activity such as brisk walking or bicycling, you can decrease your risk of recurrence approximately by about 50%. People undergoing treatment, chemotherapy or radiation, the number one side effect is fatigue, and so they think the last thing they want to do is exercise. How could exercise actually improve fatigue? But it actually does. So there's studies that have been done showing that if you start an exercise program, you'll be less fatigued, you'll have less nausea, and then it's also associated with other improving other side effects of surgery, such as lymphedema, and other side effects of treatment.
Exercise is very important for cancer survivors on a couple different levels. I think first, from a physical standpoint, you are increasing your heart rate, your respiratory rate, you're helping your body heal, especially in the sense of chemotherapy. You're helping with increased circulation to help flush some of that chemotherapy out of your system. With increased circulation, you're also getting more blood flow to areas where you had surgery, so that helps with healing at the surgical sites as well. From an emotional standpoint, I think it's very important for the cancer survivor to prove that they're still fighting and they're still winning their battle against cancer.
If you've never been an exerciser or been involved in any kind of sports or recreational program, basically starting with something is better than nothing. So for some women or men who are undergoing treatment, it may be being able to walk to the mailbox or walking to the neighbor's house, or so working up to just doing a 10-minute consecutive bout of walking at a brisk intensity. Maybe walking in the mall to get some exercise. So starting with just 10 minutes a day, maybe 3 10-minute bouts throughout the day, could be considered exercise for that person. Someone who had been doing an exercise program, maybe even something what we call like the weekend warrior, where they only exercised on the Saturday. They got out and they did an hour-long hike at a park with their family. They were doing something, but it was just more on a 1 or 2 days a week. So for them, it might be establishing a routine where they do something 3-4 days a week for 30 minutes. And then, of course, the person who was more of an avid exerciser, it would be ideally getting back to the program they were doing before their diagnosis, and maybe even pushing themselves a little bit more to, maybe they had that goal. Maybe I'd like to participate in a 10K race. So it's all dependent on where you were before maybe your diagnosis, or what your lifestyle was earlier, and then kind of building from there. But my motto is always, something is better than nothing.
A lot of times for people who are a little more apprehensive about exercising, I might recommend maybe not necessarily a support group, but to find 1 or 2 people that you feel very comfortable with and say, talk to them and see if you can, get together like a little neighborhood walk, or meet a neighbor, down at the beach or something like that for a walk. So that way you have a little bit of support while you're actually out exercising.
What's really important to realize is that nowadays there are certified exercise trainers, certified cancer exercise trainers, who can work with you to develop a safe exercise program, strength and aerobic exercise program, dependent on your cancer type, the surgery, the treatment you had, your time since diagnosis, what was your activity level before your diagnosis. And these certified trainers are certified through the American Cancer Society and the American College of Sports Medicine, and they are national, so you could find one in your state or in your community, and perhaps work with him or her to develop an exercise program.
The important thing about being a cancer patient and being a cancer survivor is still staying true to who you are. Don't let the cancer define you. Don't let the cancer take you over. You're still who you are at your heart. So continue to live your life to the best of your ability. If you're in treatment and you have to make modifications, then so be it. But it's better to make modifications than to not live your life the way that you're used to living it. So I think that's true if you're in treatment, and I think that's true in cancer survivorship as well.